Okay, so now we're going to start talking about the process of prenatal care. First of all, pregnancy testing. Most women now seek care after a positive pregnancy test because we have easily available over the counter, usually affordable urine HCG test. The pregnancy is usually confirmed at the initial visit. Remember, we talked about that obstetrical history. In that initial prenatal visit, we want to get more information about every pregnancy. So we want to start from the beginning. How many pregnancies have you had? Can you tell me about each one of those and what happened? Because we're looking for history of complications, history of normal uncomplicated births. What is that person's obstetrical history? Remember the 5-digit GT-PAL system or the 2-digit G's and P's system for noting that. But we really are going to get in depth and get more information about each one of those. The due date should be estimated, and that is estimated based on LMP. They may also use serum HCG level or ultrasound to adjust those due date estimates. In the initial visit, also in the history, you want to talk about the reason for seeking care. We might make the assumption, oh, they just came in for prenatal care, but maybe they're having a complication or a symptom they need help with. So ask the patient the reason for seeking care. Can you tell me what brought you here today is a good way to do that. We want the history of the current pregnancy, the obstetric and gynecologic history. So we've talked about obstetric history a little bit. We also want to know, when did your first period start? How old were you? What's your menstrual history been? Have you normally had regular periods? Do you have really difficult periods? Do you have any known disorders of known menstrual or obstetric disorders? Contraceptive history. And the major reason we want to know this is to find out if they maybe have an IUD in place that could complicate the pregnancy. What type of contraception have they been using? We want to know if they have a history of infertility or gynecologic conditions. Sexual history, that's mainly for risk determination. Do they have a history of STIs? When was their last pap smear? When was their last menstrual period? We also want to do a general health history and review all the body systems. We want to focus as we go through those body systems. We want to focus on things that could either make pregnancy more risky or that could be worsened by pregnancy. So for example, if they have a history of heart disease, we need to get a lot more information about that, because some types of heart disease can cause pregnancy complications, and sometimes pregnancy can worsen heart disease. So we want to make sure that we know their health history. We want to know about allergies, obviously. Do they have any chronic diseases? Have they had any surgeries? In particular, surgeries involving the reproductive system, because if they've ever had a surgery that required a uterine incision, especially higher up on the uterus, they may be at increased risk for uterine rupture in late pregnancy or labor. So we want to know history of surgeries. Nutritional history. Do they have food allergies? We'd like to know how their nutrition is. So we would maybe have them do a food diary or some nutrition assessment. Do they follow any special dietary practices? Are they having any cravings? And if they're having cravings, are they craving anything that isn't food? And we want to make people feel comfortable letting us know that. So you want to ask that in a non-judgmental way. Do they have any gastrointestinal symptoms? Nausea, vomiting, constipation are common in the first trimester. Do they have any chronic conditions or surgeries that could compromise their nutrition? We want to know what medications, drugs, or herbs may have been taken before they found out they were pregnant. We want to know what medications they use on a regular basis, because sometimes those won't pose a risk and they can continue using them. Sometimes they might pose a risk in pregnancy, but the risk of not taking them is greater. So we would encourage them to continue using those. Sometimes the risk to pregnancy is great enough that that medication may need to be changed to something different. They may need to take a different medication. So we want to know about meds. We also want to ask non-judgmentally about other recreational substances. And are they taking any herbal remedies? Drug testing is commonly done in pregnancy. State laws vary about who can be drug tested and in what circumstances, but there are practices that actually drug test every patient at every visit because they have a high rate of patients who are using substances. So make sure that you know state law involving drug testing. We might look at a family history, and we could get a 3-generation family history to kind of get an idea if there are some increased familial risk around birth and childbearing. We want to know about chronic illnesses in the family, in particular ones that may have a genetic component. We want to know if there's a family history of pregnancy complications, and if there are any known genetic or familial disorders. Social and occupational history. I would want to know if that pregnancy is planned or unplanned, because that may affect how the person is adjusting to the pregnancy. How are they feeling about the pregnancy? Is this a planned, wanted pregnancy? Is it a surprise, but they're excited? Is it a surprise that's really not at a good time? So we want to, how are they feeling about that pregnancy? What kind of support system does that person have? Do they have family support? Do they have concerns about finances, about childcare, about work, or about living space with a new child? What kind of coping mechanisms do they have? How do they handle stress? And do they participate in any occupational or recreational activities that may be a risk for pregnancy? Do they have a job that may be a risk for pregnancy and they need to have job duties changed for that time? Or do they maybe they like to ski, or they like to go horseback riding? What things do they do recreationally that could potentially pose a risk? Mental health screening. Perinatal depression is very, very common, and it is overlooked. We hear about postpartum depression, but for a lot of people, that depression begins in pregnancy. And it can be because of all of the anticipation of all of the life changes that are going to happen. But hormones also can play a factor in that. There are some risk factors that someone is more likely to experience depression or anxiety if they don't have a supportive partner. Okay. No partner might actually be less stressful than an unsupportive one for some people. But if they don't have a partner that's supportive, if they don't have enough social support, if there's a history of intimate partner violence, if they have a personal history of mental illness, that the hormones can actually affect their response to their mental health meds. If it's an unintended pregnancy, if there are complications or the pregnancy is lost, and if there are other stressful life events. We also really need to be screening for abuse every time we see pregnant patients. Physical abuse often begins in pregnancy, and that relationship was usually abusive before, but the types of abuse were different. Physical abuse is more likely to begin in an already abusive relationship. It's common for that to tilt over into physical abuse during pregnancy. So the best screening question for abuse is, are you safe at home? If I ask someone, is there any domestic violence in the home? What happens to me is not domestic violence. Okay, what happens to me is just a complicated relationship. So you want to ask people, instead of, is there domestic violence, you want to ask, are you safe? We also need to be thinking about the potential for dealing with trafficked persons. Okay, so the next section, we're going to talk about the physical exam.